I just got off the phone from the cabinet and Dr. Williams. The message is, number one, 50% of the cases are with younger people now. And I got a message to the young folks, guys, this party's not over. You know what I mean? You just got to make sure you follow the protocols, follow the guidelines, because what happens? You bring it home to one of your loved ones, your parents, your grandparents. It's unacceptable. When we're seeing 50% of the cases from young people, and by the way, the young people, when they get in ICU, they stay there a lot longer, so they're taking up more capacity. So I just can't stress it enough. You go down the street, and especially in Toronto, you just can't. Guys, we got to watch it. This is serious. So please follow the guidelines, protocols, and we still have a ways to go before we can loosen anything up.
Let's bring in Dr. Callie Barrett in Ontario, one of more than 150 doctors who signed a letter recently asking for the provincial government in Ontario to crack down. Good to see you, Dr. Barrett. Thanks for your time.
My pleasure.
Okay, so walk us through this now. The shutdown looming, too much, not enough, too little, too late.
I think it's really disappointing. The Premier is relying on a framework that's doomed to fail. We've been in gray lockdown in Toronto here for months, as you said, and we are seeing exponential growth of this new variant of concern. So while I appreciate that the Premier is changing measures in other regions of the province, unfortunately, he's relying on measures that are not working here, just as just about every single reporter during the questions couldn't understand the rationale behind it. It's not going to work. This is really disappointing.
Tell me about your number one concern as it relates to intensive care units, Dr. Barrett.
Yeah, so we are very concerned about the state of our critical care capacity in the province of Ontario. We are still recovering from the surge of cases that we saw during wave 2 of the pandemic. That was around January 15th. We barely caught our breath from that, and then the VOCs started to take over, and we're seeing another rapid surge in admissions to our ICU. We've seen the highest number in our ICUs with COVID-19 over the past 2 days. We've had a record-breaking day in terms of new admissions a couple of days ago with 46 new admissions overnight to the ICU. So we're really it's an accelerating pace right now, and what our greatest fear is that the number of patients with critical illness in the province of Ontario is going to exceed our capacity to care for those patients. And it's not just beds or ventilators, it's actual specially trained physicians, nurses, respiratory therapists. We're really like a highly specialized team that we work together to care for the sickest and most complex patients in our healthcare system. And we can't magically be duplicated. Up till now, the Premier has clearly had a very difficult task at hand, balancing the economy and the pandemic. And I think the really important thing is we can recover from economic downturns. Businesses can recover, but when you're dead, you're dead. We don't get our parents back if our parents die. We don't get our loved ones back. Children will lose their parents. This is literally a matter of life and death. And I think it's time for the Premier to really prioritize human lives over the economy.
So what you're seeing is lungs filled with fluid.
It's one of the devastating impacts of COVID-19 on young people. Here, lungs of a 30-year-old sent to the ICU. This, a 35-year-old teacher infected with the UK variant.
They would have enormous trouble breathing. They would feel short of breath. They would look like extremely tired, which they were when we saw them.
Toronto ER physician Dr. Kashif Prasada says compare the infected lungs to what they should look like. He shared the images to show how COVID is brutalizing the young.
I think all of us are kind of shocked at how young these patients are. What worries us is that people are unaware of this, that people are taking risks, they're going into crowded settings, but they have no idea how bad this thing has gotten.
The age of people with active cases in Ontario now heavily leans to those under 60, the highest group of people 20 to 29, with variants driving more than half the growth. Peel Region's medical officer of health knows people are tired of COVID. He says cases are still coming from workplaces, households, and more recently clusters from social gatherings.
No matter how old you are, you don't know how your body's going to react. You don't know how your immune system is going to fight the disease.
Leaving doctors pleading, keep up with precautions, stay outside as much as possible, and hang on a little longer.
We've got the Walking Dead protesting here. Reprehensible, dangerous, wrong. Those are just a few of the words used to describe a recent editorial in the Moose Jaw Today newspaper and on its website. In the editorial, senior editor Joan Ritchie questions the number of deaths attributed to COVID-19. She laments the restrictions to church services. Then she says the following: "Sort of reminds oneself of what Hitler did to the Jews and where worshippers are going from here, doesn't it? Lockdowns in homes, then lockdowns in hotels, then lockdowns in facilities, then lockdowns in internment camps." One Moose Jaw resident said this editorial is harmful on so many levels. She says it minimizes the Holocaust, but it could also cause more sickness and death in her community.
Well, I feel it's wrong because people are swayed. We're a year into a pandemic. We can't have people in our home. It does feel pretty awful at times, but that doesn't mean it's not real.
A University of Saskatchewan professor who's been tracking the rapid rise of COVID-19 variants in Moose Jaw says this type of propaganda could make things worse, and more needs to be done to make things right.
I don't think the apology is really sufficient in that you shouldn't responsibly be able to make these inflammatory sort of comparisons to Nazi Germany if you want to be taken seriously as a publication.
Following a wave of criticism, Moose Jaw Today removed the article from its website. In a statement, they said, "The editorial inappropriately compared pandemic-related lockdowns to the Holocaust. Glacier Media expresses its regret for this error." No one from Moose Jaw Today could be reached for comment. But as for Terry Jago, she's hoping Moose Jaw residents and businesses will think twice about supporting Moose Jaw Today until officials do more to undo the damage they caused.
Canceled and changed to June 29th.
Instead of 3 weeks, Rochelle Eisen's second vaccine dose is now scheduled 4 months later.
I think people that are elderly and can't wait 4 months for the second vaccine because they may not make it.
The Eisens are waiting for shots due to a guideline issued earlier this month, a guideline that could soon change.
Now they're going to be meeting about it, and they're going to be looking at it in great detail.
They are Canada's National Advisory Committee on Immunization, or NACI. Based on emerging evidence, the committee advised the second dose of COVID-19 vaccine could be delayed up to 4 months, allowing more people to get first doses, arguably saving lives. But critics say delayed dosing is putting older Canadians at risk.
What we're learning now is there are certain subpopulations that probably we need to think about having a little bit more nuance in terms of this guidance.
This small study looking at over 150 cancer patients in the UK is preliminary, but the research suggests after receiving their second dose of Pfizer vaccine 3 weeks after the first, 95% of cancer patients had evidence of an antibody response to the virus. That number fell below 40% when patients waited 5 weeks between doses. But experts insist antibody testing doesn't tell the whole story.
Like, there's not a test that says, yes, you're protected and no, you're not. At this point, we don't have a correlative protection.
Meaning it's not clear what level of antibody response is needed to attack this coronavirus in order to protect us.
'63-year-old Jose Roberto Ignacio spent most of his career as an ambulance driver, transporting the sick from his small community to the nearest major town. He got sick from COVID a few weeks ago and, along with 69 others, waited for one of the 50 full ICU beds near him to open up. He died waiting.
Ele deu a vida para aquilo ali, tentou salvar muita gente, mas a hora que ele precisou mesmo, não salvaram ele, porque não tinha nada, né?
This is the reality of a healthcare system on the brink of collapse. Brazil, Latin America's biggest country, is now the epicenter of the global coronavirus crisis, surpassing more than 300,000 deaths, with an average daily death toll higher than any other nation. For Sao Paulo ICU nurse Flavia Machado, it's more than she can handle.
We have been doing this for a year now, and it causes additional stress, which is the stress of knowing that we are not helping everyone who needs us. The stress of knowing that when a patient leaves, I already have 4, 5, 6, so many.
Most of the recent cases have been caused by the variant P1 born out of the Amazonian city Manaus. The P1 strain is more contagious and is able to reinfect up to 61% of those who should be immune, and it's already spread to at least 20 other countries, including the United States. ICUs in 25 of Brazil's 26 states are now at 80% capacity, seeing patients sicker and younger than the previous wave.
What we're seeing now are patients arriving quickly, and we are unable to cope because we always knew patients spend a long time here. They stay in ICU, and there are no vacancies for more patients to arrive.
But among local officials, there's growing acceptance that lockdowns are unavoidable. Rio and Sao Paulo imposing extensive restrictions, creating a 10-day holiday to encourage Brazilians to stay home. But some Brazilians are resistant, thousands taking to the streets to protest the new measures.
Today, I am protesting against João Agrippino Doria's dictatorial attitudes. He wants to impose a lockdown on the population, put an end to employment, put an end to health, to put an end to the people of Sao Paulo.
Given the huge volume of patients, we start to suffer from the scarcity of basic materials. We are going to have serious problems in the coming days with sedatives and neuromuscular blockers. And this does not only apply to our hospital, that's for all of them.
As health officials have warned since the pandemic began, if the coronavirus isn't contained in all places, it will have the chance to spread or mutate, posing a continued threat to the world.
Hospitals in the Greater Paris region are close to reaching saturation point. That's according to senior hospital doctors who are warning that intensive care units will soon be overwhelmed in the Ile-de-France area and that staff may have to start triaging patients within the next 2 weeks. Writing in a Sunday newspaper, 41 specialists warned that doctors would be forced to choose between patients in order to save as many lives as possible. They said this would affect all patients, those who'd contracted COVID and those who were being treated for other conditions. One of those who signed the letter said it would place doctors in an impossible position.
Si on arrive à plus de 50% des entrées qui sont des gens de moins de 50 ans, et on y est presque, ça va être extrêmement difficile de devoir faire des choix parmi des gens âgés de moins de 50 ans qui par définition sont jeunes.
Intensive care units have treated an average of 1,400 patients each day this month. That's lower than the average recorded during the peak of the first wave of infections last spring. But doctors say that was during a much stricter lockdown and with 80% of surgical procedures postponed.
Si il n'y a pas de mesures supplémentaires, le 22 avril, on sera à 30% de plus de malades à prendre en soins critiques par rapport donc à la première vague.
Doctors are warning that lockdown restrictions currently in place in Paris and several other departments won't be enough to curb the spread of infections.
Already quiet, this Vancouver restaurant that relies mainly on indoor dining will be hit hard by new restrictions, the tightest in nearly a year.
For us, it means we're going from about 90 seats to 19, and we'll be laying off about 90% of our staff.
The reason? The 7-day average is now nearly 800 cases per day, and health officials say it's critical to reverse the trend.
A circuit breaker is now required to break the chains of transmission in our province and allow us to safely move forward through this next phase.
She says indoor activities are the biggest threat, so dining inside at restaurants, indoor adult group fitness classes, and in-person religious gatherings will be suspended for at least 3 weeks. BC's Premier points his finger at 20 to 39-year-olds, saying they're not taking the threat seriously enough.
My appeal to you is do not blow this for the rest of us. Do not blow this for your parents and your neighbors and others who have been working really, really hard, making significant sacrifices.
Another big impact, the immediate shutdown of the province's largest ski area, Whistler Blackcomb. The resort has seen a significant number of cases, and it's also being criticized as a magnet for non-essential travel.
This is devastating, and it's not something that we can take on alone. We will need the continued support of the federal and provincial governments.
For now, dining on patios will still be allowed, but for many businesses and workers, more financial pain. Officials say it's necessary despite the hit.